Good afternoon and welcome to PFC's webinar today on COVID-19 second wave. What's next for philanthropy? Bonjour et bienvenue à tous et à toutes. Thank you for joining us today. My name is Lauzière. I'm Director of Member Relations and Research at PFC. Also with us today is Tim Ellis, PFC's Research Coordinator, who will be moderating the questions. So thank you for joining us. Just a few reminders before we begin. We ask that you please remain on mute to ensure the sound quality throughout the webinar, and you can use the question and answer box to address any questions to any of the panelists. We'll be moderating that Q&A box. We may not be able to get to all the questions, but we'll certainly do our best to get to most of them. And just a quick reminder, of course, that the session is being recorded. And finally, the speaker biographies will appear in the chat box. So if you're interested in learning a little bit more about our speakers, please feel free to consult the chat box for more details. So without further ado, I know you're anxious to hear from our panelists, so we'll get started. I want to first present our moderator, which is Jean-Marc Mangin, President of PFC, and who will be moderating this session for you today. So over to you, Jean-Marc.
Merci, Lisa. Thanks to our esteemed panel today. They're all leaders of the philanthropic community from across the country, and we had the pleasure of listening to their insight right at the beginning of the crisis, 1 month in, and now at the onset of the second wave. It's an important discussion to have. Je vous invite, bien que la conversation va se faire surtout en anglais, le panel est parfaitement bilingue, donc je vous invite à poser vos questions dans la langue de votre choix au cours de l'heure qu'on va avoir ensemble et de les mettre dans le Q&A qui est en bas de votre page. But before I start, I just want to do a land acknowledgement. And it's important, more important than ever to do that at this time, not only because the crisis has been a huge revealer and anti-racism movement has been, as you know, a global phenomenon, but it's very real, as we saw with the tragic death of Joyce Chachouan last week in Joliette. At the hospital, so that where racism was at the core of her life story, unfortunately. I'll invite you to reflect on the land of where you currently are standing. So to begin, we'd like to acknowledge the many territories of Turtle Island on which we work and reside. These territories are home to many indigenous peoples who have lived here for tens of thousands of years and continue to live here. As settlers, immigrants, and descendants, and as visitors, we honor and respect the many indigenous peoples of this land and territory and hope for a more just future together. Donc, let's start in terms of where we are. So I'm going to invite each of the panelists to give us their reflection on what is the most effective role for philanthropy in the midst of this prolonged and complex crisis. Should philanthropy invest in solving the cause of the pandemic, or leave that to governments and only focus on its more urgent consequences for the population? So on that, may I invite Marcel to get us going. Marcel, you're on mute.
I am on mute. Sorry, I'm going to be doing this. Bonjour tout le monde. Well, there are a number of questions there, Jean-Marc. I think in terms of what's the most effective role, I was thinking about that. I don't think there's one answer to that. I don't think there's one size fits all. From the experience that I've seen from my colleagues in the foundation world, a number of us have really gone through the very urgent matters on the ground. doing maybe things that we don't normally do, like, fund shelters and fund food banks and fund youth mental health organizations that are at the front line at the coalface of COVID. We've always done some of that, but we've done a lot more of it. But we've also tried to be a bit more strategic. So I think it really depends. I think the requirements, I guess, and the demand on the ground was so huge. I don't think there's one answer to that. In terms of government and their role, clearly foundations can't step in where government should be stepping in, no doubt about that. That being said, I don't think we can leave everything to government either. And as we see how COVID has been managed or badly managed, depending on the government and the province across the country, I would say, we can't just trust our governments to be there. So I think it calls upon us to look at new collaborations with government, looking at more complementarity. So I think it's a mixed answer. I think the variety of things, we're learning a lot, but I think there are many foundations out there that are doing very different things. The last thing I would say, I think, is the most important thing we can do right now is to be listening. In French, we say être à l'écoute, and that means, having the right advisors at the table to help us decide where the money should go, having the right partners, being on the ground. So we really need to listen because the world is changing very fast.
Conrad, I mean, you lead an independent organization, but you have a very close working partnership with the government. Any views on that question in terms of what's the proper responsibility between governments and the philanthropic sector?
Well, first of all, I think again, foundations, certainly family foundations, and the charitable sector has responded well in terms of adjusting itself to the urgency. But I think that the question is, on the prolonged pandemic, really, there's a larger question on how we are unprepared in Canada to deal with crisis and how we lack a culture of preparedness. And I think, Jean-Marc, you opened up with, this was a great revealer. Well, what did it reveal? And there's a lot of the questions that you asked that we're going to talk about today. It revealed our unpreparedness. Certainly governments, we're going to be taking stock about that. Some places in the world were much better prepared. We were collectively building the plane on the tarmac, but how do we get out of that posture? Now we're talking about pandemic, but the pandemic was predicted, actually. It's predictable, and it was predicted. It was on the risk registry that this could happen, and then we were all surprised. Now, I think there are other disruptive events also that are on the horizon that have been predicted, the rise in climate events and other types of disruptive events. So again, what does this tell us in terms of how do we need, of course, government has a role, but it's a shared role. We have a role as citizens and in organizations. What does it tell us about preparedness? And I think one of the aspects, certainly, as we'll get into another conversation, what resiliency means in terms of core funding. There's questions here about data as well. We're poor in technology, we're poor on data, and we're poorly prepared in a lot of cases. And we had a number of blind spots as well in terms of organizations, communities that were more vulnerable. We had blind spots to them. So this revealed this. So I think there's a lot of taking stock, not just of pandemic, but in terms of crisis preparedness. And I've got more to say in terms of this pandemic, but I'll leave it at that.
Thanks, Conrad. Claire, you're involved in the Quebec Philanthropic Consortium in terms of the philanthropic response in Montreal, especially, but also you're wearing a hat from your work at McGill and the network of scientists and researchers on the front line of finding a public health response to a crisis. Your views about the division of responsibilities between governments and the philanthropic sector.
Yeah, thanks, Jean-Marc, and thanks, Conrad, for pointing out that this was, in fact, a predictable event, and it is a terrible thing that we're all living through, and it may not be the only pandemic we live through, and we're certainly not out of the woods. And I think back to the first panel we had all of us together at the beginning of all of this, and I have my notes from then, and I remember saying that people need to sort of make peace with the fact that this is going to be a long-term problem. This is not, or a long-term crisis. We are definitely not out of the woods. it's going to be with us for quite some time into 2021 and perhaps beyond. So we need to kind of find ways to reckon with the current reality of the situation and act as best we can. In terms of responsibilities, you know, I agree that unfortunately the responses have been spotty at best by different governments at the provincial level here in Canada, and comparing to responses in other countries in Asia and Africa and Europe, in the Americas. You know, I think that we could learn from best practices elsewhere. In terms of the philanthropic sector, I think we can act as catalysts for change. And I think that that requires going outside of our comfort zone. You know, at our family foundation, historically, we've been a traditional family foundation. You know, we receive grant applications, we review them, we try to make the best decisions we can. And we have acted proactively in the past, especially in climate change, but this crisis has really highlighted the need for collaboration and for being proactive in identifying where are the needs, not just sitting back and waiting for applications to come in, but actually to go out into the ground and look where the needs are and work in collaboration. And really glad to have the support and collaboration of PFC and our partners at the Molson, Saputo, and Jaroslawski Foundations, working in partnership with them to support the most affected communities here in Montreal, and as well as some transversal needs in testing and tracing, for example. So I think really thinking outside the box and seeing how you can act as a catalyst, and actually going out and proactively looking at where the needs are, thinking and acting very differently than a lot of foundations are used to, I think is the way to have the most impact at this time.
And Kevin, you know, you're sitting in Vancouver, the province with the some would believe that with the best performance in stopping the pandemic. What's the recipe that the rest of the country should learn from, and what is the role of philanthropy in stopping the pandemic?
Well, thanks, Jean-Marc. I hesitate to give the recipe. I would just encourage people to listen to Bonnie Henry, Dr. Bonnie Henry, and she's providing some great leadership for us in BC and for others across Canada. But I agree with a lot of the things that co-panelists have said. But what I would bring to the conversation is really it's important for philanthropy to understand both its strengths and its limitations. And I'll talk a bit about our limitations first. When we saw governments swing into action with the wage subsidy, with other supports, it was quickly evident to all of us that philanthropy cannot play at that level. We simply are overwhelmed, and nor should we try to. It's important for us to understand what we can do well and play to our strengths. And I think what we can do, what we do well, is we can act much quicker. Vancouver Foundation had its grant programs up and running before government programs were in place. We know the Red Cross is a quick reactor. And so the non-governmental sector, the charitable sector, can act very quickly, and we need to play that role. We have much closer interactions with the people who are being impacted by the pandemic than any government does. It's day to day, it's person to person, it's that intimate knowledge of what's happening in communities and who's being affected that really needs to inform those larger systems that work at scale. And we have, we can demonstrate ways of working that are effective. And I would say that the philanthropic community has, in the last little while, really demonstrated how important it is to bring the voice of the communities you're seeking to affect to the front, to place those voices at the center of designing a program, to trust the organizations that are delivering programs to do the right thing without a lot of encumbrances and baggage and contracts, to really work in the spirit of generosity and trust. And I think if we're doing that, playing to our strengths, then the obligation for us is then to cajole, to advocate, to harass, to champion those bigger systems to work in the ways that we demonstrate our communities need and respond to.
Thanks for that. I do see some commonality threads between all of your response. I mean, that one isn't a binary choice between the government and our role, but they can play to our strength and to be in the listening mode and really put our partners forward in terms of response, but also acknowledging the very much middle of the pack performance of Canada in dealing with the crisis so far. So now we're entering the second wave. So what do you think would be the role of philanthropy now to play throughout the second wave, but also in the potential recovery? And what are your most important concerns? What are we missing? Any blind spots and critical needs that the philanthropic sector should address that we have not yet addressed? And I see Claire smiling, so I got to start with you, Claire.
All right, I'm waiting for you to, I should not smile. Yeah, I mean, I think that there are definitely ways that the philanthropic sector can improve. There's also a lot of variable ways in which people are acting, and I think it's important that we not all act in the same way. You know, there's room for a diversity of approaches, diversity of actions. I think that one thing that I would encourage, which I mentioned earlier, is really getting out of the comfort zone. You know, I think that this is a very serious, significant crisis. We are now in month 7, I think. I'm losing track of time. We have at least another 7 months ahead of us, I believe, in this crisis, if not longer. And so, you know, now is the time to act. We have the capacity to act. We have the means to do so. So I would encourage foundations to spend more than they had originally budgeted in their fiscal year, and to consider spending differently in order to support some of the priority needs that are happening, in order to support communities that are most affected. I think that, you know, the way Kevin described it, you know, is exactly the right approach. So I would really encourage people to really go outside their comfort zone and not just stick to supporting the organizations they usually support. You should absolutely continue to support the organizations you currently support. I know a lot of organizations are under a huge amount of pressure. You know, so you should definitely maintain that support and be, you know, at écoute and listening to your grantees and continuing to work in partnership with them. But I think that challenging yourself to go beyond in this moment of crisis, I think is what I would very strongly advocate.
Marcel?
Can I just build on what Claire was saying when you started off, Claire, and talked about the fact that we should not be doing the same thing. There are diversity foundations out there, and a prerequisite for that, of course, is that we talk to each other more, that we not only collaborate, but look at how we can learn from each other. One thing that hit me during the pandemic again is how, again, looking at our provinces across the country that should all be like laboratories, trying different things and learning from each other, and we're not. And I think sometimes in the philanthropic sector, we're very much the same. We do talk to ourselves, but I don't think we do enough in terms of really learning and figuring out how we can be complementary with each other. Love to see us pool resources in a much better way. I think the Europeans do this much, much better than we do, especially when they want to address big societal issues. And the last thing I'd like us to think about is, I know a number of foundations, including Lawson for sure, are very much in the strategic mode, right? Very much in looking at systemic change and looking how we can really transform things. And I'm a big believer in that. But at the same time, what came out for us during COVID is there's also so much of a need for organizations, frontline organizations, those at the cold face of COVID, that larger, more strategic foundations often forget, I think. And so for us to talk about how we could find a better balance between how we support the big transformational stuff, and at the same time, those organizations on the ground that are really, you know, the ones that are allowing communities to survive in a day-to-day basis. So those would be a few of the things I would raise.
I mean, we see the beginning of this tidal wave hitting the community sector and not-for-profit sector. And Kevin, I'm sure you see a lot of it. So what are your key concerns moving now and for the next few months?
Well, just to build on a comment Conrad made earlier about data, about how little data we have really very little economic data on our sector. And Bruce McDonald of Imagine Canada pointed out that our agricultural sector data is so good, we can tell how many cabbages are being consumed in Canada on a weekly basis. But we don't know the economic size of our sector until like the T3010 data for 2019 won't be available until mid-2021. So we have, I was heard our sector described, I love this phrase, we're the safety net for the social safety net. So as our government systems, as people fall through those systems, they tend to land up often with the programs of charities. But the charitable sector is incredibly stretched. And the other CRA data is interesting. There are less than 4,000 charities all across Canada registered under either relief of poverty, dealing with seniors, supporting health, or other community benefits. Less than 4,000. There are 4,300 Tim Hortons in Canada. And so when we think of the capacity of our sector to deal with the size of the problems that are coming to us, I think we need data. We need to know which charities are actually at risk of closing because it's the services they're providing that are essential to their communities, and we just don't know. We've done surveys and asked charities what they think is going to happen to them, and many anticipate closing in the next few months, but we actually don't know if they're at an aggregate level what's happening in our sector. So we really do need better data on our sector so that we as funders can help target that funding to ensure those essential services continue in communities and do that in a much more effective way. Resources are scarce, and the best way that we can actually ration them is on the basis of data. And the other thing I would just mention on data is we also don't have good data on a demographic basis of who we're supporting, either race-based or demographically based or community-based. And even those, many of us who have done that in our own programs, we can't aggregate that collectively in a meaningful way. And so we're in a context where it's clear the pandemic is affecting certain communities dramatically. We have population level data that shows that, but we can't simultaneously show how the charitable sector is responding. So our ability to target our resources and demonstrate our relevance in the crisis are both undermined by this lack of data.
You're perfectly right there with the lack of data. I'd like to point out two things. The Not-for-Profit Network has released a survey late this summer that indicate that 20% of not-for-profit and charitable organizations are seriously considering closing their doors by Christmas. Whether or not they go through, but we know their reserves are being depleted. People, and we're hearing of executive directors using their personal credit card to pay the bills of the organization. So we know they are stretched to the limit. And I'd like to also point out that PFC is involved in the beginning with the support of the Ontario Trillium Foundation in the Data Strategy Initiative, working with SaskCan, working with leaders in the sector to see how we can do a better job on the data front. Conrad, your concerns about now and moving forward.
Well, I'm going to keep the same theme again as what has the pandemic revealed, and I think I'm going to agree with everybody, and I just want to put different emphasis. I think to Claire's point, absolutely. I think there are frontline groups and changing the way we approach in the crisis and supporting some of that community side. Governments are always slower to respond, and there are gaps in the system, and we're seeing gaps at different levels. So certainly, and we've been involved with the initiative in Montreal North. I think working together a lot more in that respect is critical. And then to Marcel's point, I think as well, I mean, there's different roles. I think one of the challenges and the problems of this response, again, is nobody's looking ahead. And, you know, and I know because we're dealing with governments, everything's about next week. We have to think post-crisis as well, although it's hard to see, but recovery is going to be very difficult as well. We know, among other things, mental health issues are going to be on the rise as well as a concern, but there's going to be a complex recovery period. And then I think I'm coming back to the point on data, which is you know, we don't have a good starting point here, and we do have tools, and the T3010 as an example, of course, was not made for what it's used for, but it's maybe the best tool we have. I think we have to lobby to make sure it's more comprehensive, more complete, it's gathering the right data. We're involved also with ESDC in funding nonprofits, non-charitable organizations in the community, small organizations of less than 100,000, the Red Cross. So we funded, I think, over $40 million during this crisis. And of course, most of them are unknown. Most of them don't file because they feel they're not charitable. They don't need to file and therefore there's no data on them. So, you know, again, when you're going into when you're going into the problem and you have poor data to start off with, it's hard to be able to respond. So I think there are different areas of work that we need to work on together. But certainly gathering data. If you don't know where the groups are, who they are, if they don't register anywhere, and you're trying to, and as we've been trying to disseminate or support different groups, you're going through a difficult process of trying to reach everybody, but they don't file their returns again, so the information is not there. And we've seen also the challenges of the interpretation of the, among other things, the T3010 by all kinds of organizations. And again, they're interpreting a document that was not made for that. So it's not well done. So I think we need to address some core issues and challenges at the same time. So we need to do all these things, and maybe it's different groups, and we need to share a lot more among ourselves and create some collective working groups.
Again, you're right. I mean, the potential of the use of administrative data that we all collectively have, and government could provide some insight of what's actually happening. But also with StatsCan, we did to go beyond the T3010 and have surveys that are appropriate for our sector and the natural profit sector, those who don't file. We do have a question. Go ahead.
Can I just to add? I think certainly the charitable sector foundations could be also catalysts in helping with the digital transformation of organizations as well, because that's another aspect, again, in terms of lack of core funding for digital transformation. I think Canada's behind in terms of data, digital technology support. And we're seeing that with all organizations not having enough resources to do this. Therefore, they're not collecting data, and we're not learning enough from these experiences, because we need to learn and improve.
That's perfectly right. We do have a question that's related to our question right now from one of the participants. So let me read it. So are the areas of needs in the second phase different from the first wave? And what are you seeing within your own philanthropic work? I don't know if Kevin, can I ask you to get us started on that one?
Yeah, I think so. As the second phase needs are actually quite similar. We did a lot of support for arts and culture organizations, and while many of them have figured out a way to deliver their programs, they're still struggling with audiences. They're still challenged. Many of them have no programs at all for 2020. So arts and culture organizations are very profoundly affected, and very little room to maneuver. Our health and social sector are facing increasing demands. If you just look at the numbers of people that are finding their only options are in homeless camps around in Victoria and Vancouver and other places, the demand for services continues to rise. And that was what we felt in the first phase. The big difference, I think, for many charities has been the access to wage subsidies to help them go, as well as some targeted funding from us and from others. So we've filled a gap, but the needs are actually quite similar.
Marcel, you're on mute.
Yeah, I agree entirely with what Kevin was saying, that, and we're seeing a bit the same. And where I think we were looking at hopefully some type of recovery, and I agree with Claire was saying earlier, we're not going to be over this for a long time, but still there was a sense that things were coming back. And now with the second wave hitting some of the provinces, we're almost like we were back to the spring. So that worries me. But one thing that worries me in terms of where we're going is there's a big issue out there that we all believe in, which is what all worried about is climate change and environmental issues. And the foundation is certainly very involved in working with youth and youth leadership in addressing environmental issues. And my worry is as this continues, there's so much emphasis, of course, on the public health issues, which is normal, that I'm worried that we're going to see environmental organizations, particularly youth voices within environmental organizations, struggling to keep a pace as this continues. So that's something that I think we need to be looking at.
Yeah, and I like to come back to that because I'm hearing from young people who make the connection between the variant pandemic and climate change. It still remains at the center, but it's obviously within the public sphere has been more marginalized in recent months. Claire, I mean, in Quebec we've seen numbers of that actually worse than in the spring in terms of number of cases and the number the pandemic feels different. Am I wrong? Therefore, does the needs change or the needs stays the same?
Yeah, I mean, it's hard for me to assess like globally how the needs change. I can just say that from the work that we're doing in Montreal at the community level, we see from the data coming in and the reports that I'm hearing, you know, people are tired, right? People are tired. I'm tired. I'm sure we're all tired, right? People are tired. It's more difficult. We know from the data that, you know, people who are positive or who are known contacts are more resistant to isolating themselves. This has taken a very big toll on everybody, but much more on communities of color, on people who are working in essential services. But the mental health toll is felt across the board, you know, and yes, in Quebec here, you know, the cases are very high. The percent positivity rate, even though we're doing way more testing, the percent positivity rate is on the rise, which is very worrisome. We see hospitalizations and deaths starting to creep up. That unfortunately is likely to also creep up if we look at what happened in France and Spain. Unfortunately, our data matches up quite closely with what we've seen happen in those countries. It is a very worrisome trend. So it's hard to predict what impacts will be felt and where the needs will be, but my sense is that the fatigue across the board is going to become even more of a challenge as we head into winter. People are indoors, it's dark. We know that the virus transmits more easily indoors than outdoors. So I think it's going to be a difficult few months. And I completely agree. I mean, on the other note of the impact on other movements like climate change, which is another cause that I hold very dear. I am concerned about how do we make sure to move forward on these other very important and burning issues of our time. In this context, it's definitely difficult, and that's why I think it is important for foundations to step up in an even more important way than usual. Thanks.
And Conrad from the Red Cross, do you see a difference between the first and the second wave in terms of needs?
Well, definitely we're seeing a lot of our work actually in support, a lot of our visible work was seen in Quebec and Montreal. Actually, we supported, I think, in epidemic control over 90 institutions. And we recruited over 1,000 additional personnel to replace the military in Quebec. And what we're seeing now is maintaining that capacity on behalf of the Quebec government, the federal government, but the same request now in Ontario. So we're seeing the rise now of the similar types of issues in different centers. A major concern from institutions as well, or what we're seeing is the vulnerable seniors in the community, how to provide support to them so that they don't end up in institutions for lacking support. Because again, you know, when you're vulnerable and isolated, how are we reaching out to you to provide the support to you to make sure you have everything you need so your health doesn't deteriorate and we add to the burden of the institutions. So we're seeing a ramp up of surge. The commonality in terms of going forward again is we need, you know, and I was saying, what I was saying from the opening statement is that we are in an environment of disruptive events, and these things are pandemic, you know, so what are we learning and how are we organizing ourselves? Obviously, the ability to surge in these situations wasn't there, and this is how we need to better prepare for the future. We're looking, of course, at the challenges around testing, around the breakdown in institutions. We have to think of, even when there's going to be a vaccine program, we haven't had a national vaccine program in this country, and I'm not in, maybe Kevin knows it better, but not that I remember of. And again, how are we going to reach everybody with that, and how are we going to manage the manpower with that at the same time that, you know, there's a backlog of people to be treated in institutions. So we need to look at the immediate, we need to look at the immediate future, and we need to look at the future. And again, I'm coming back to the future aspects of what have we learned ourselves, and what would we do better, or how do we need to be better prepared going forward. And there is a connection, I think we need to make it between, there is a definite connection with the pandemic, with climate change, with disruptive events. We need to, of course, we are in the consequences of these. We need to prepare to respond to these. And of course, hopefully that also enlightens our understanding and our concerns about our own footprint, and engages in that. I'm going to say one last thing on that, and we'll get to that in terms of how it changes. The other concern is we're going in a world of inward looking, where everybody is inward looking. We have the rise of protectionism, the rise of isolationism at the same time as everybody's concerned with their own needs, rightfully so. We don't want to be, we're less engaged internationally. And there's going to be a big challenge there as well, because this is also not just a national issue, it's a global issue. So a few concerns there.
A few very dark clouds, and before the conversation goes too dark, and there's also, I think, sources of hope when we've seen a massive mobilization around the anti-racism movement. And I'd like you to perhaps share your personal reflection about the implication of the anti-racism movement on your organization, and how you're approaching that. And I'm also seeing other questions coming in, so I invite people to come in, and I've seen a couple of participants raising their hands. If you can type your question in the Q&A section, we'll get to it. We'll get to it very soon. But in the meantime, if we can talk about the implication of the anti-racism movement on philanthropy and on your own organization. Kevin, maybe let's start with Kevin this time.
Yeah, happy to kick that off. So as a community foundation, one of our aspirations is that all members of our community will see us as a vehicle through which they can accomplish their philanthropic and charitable aims. And it's become very clear to community foundations across the country is that many communities don't see us as the vehicle for their philanthropy, because we've traditionally not included, excluded, in many ways functioned in ways that we're not welcoming. So we've really, this movement has really drawn clarity for us about how, if we want to live up to our aspirations of being a community foundation for everyone, we have to address systemic racism. We have to recognize our own contribution to that. We have to recognize how we've perpetuated and benefited from those structures. And so we've made 5 commitments as an organization, and commitments across the community foundation movement that are critical to us reaching our vision of being a community foundation for all of our communities. And so that it has been really quite profound. And it's not a new journey for us in many respects. Our work on reconciliation in BC was, at the Vancouver Foundation at least, was really taken on seriously in around 2013. But the extent of what we've learned from the pandemic has really made us feel that our efforts to date were insufficient. And we have to really double down, get serious, and focus really on ourselves, who we are, who's on our staff, who's on our boards, who's in our volunteer committees, who are we granting to, what systems have we put in place that make that grant making inaccessible or difficult or challenging. So it has been a real journey for us. And I really want to thank our staff, our volunteers, and our board members. So those that are part of the foundation already are really the voices that are saying we have to do better. And it's those internal constituencies that have really given us the both the challenge and the spark and the courage to say we need to transform who we are.
Conrad, what about right in the field with the Red Cross movement? How is?
Well, I'm gonna echo a lot what Kevin said. I think the first part for an organization like the Red Cross to recognize, not because we're a humanitarian organization, that we don't have our blind spots, and we don't have to address the issue of systemic racism. So this was we engaged, I think, first of all, as an organization, a major internal discussion, and gave a voice to our staff, and you know, how they perceived and questioned a number of things, and how we were coming out of that with a more deliberate approach to make sure that we don't have blind spots. And, you know, and again, I want to, it's not because you're a humanitarian organization and your mission is for good that you're not, you don't have systemic blind spots for a number of things. So there's a conscious discussion internally and a commitment to some deliberate changes that we've identified over the next 5 years, but a conversation internally. And I think that's very important. And I think to Kevin's point, the other aspect as well is that there's our own internal representation and barriers, and how does that affect the people we serve? And I certainly think during this pandemic, the fact that some communities were overly impacted, there's obviously a blind spot to their needs, and understanding that. If we remember the beginning of the whole pandemic, it was about ICU and ventilators, not about overly impacted community and the work at the challenges at the community level, that there were workers. Some of the health sectors were overrepresented by, among others, new migrants, that they were in the same communities, that they were not left with any kind of support, and so on and so forth. So I think this has brought up a lot of internal and external reflection on how we work.
What about a family foundation? How does a family foundation deal with blind spots and anti-racism? Claire?
Yeah. I mean, I think at a family foundation, it is definitely complicated because the board is all family, and in our case means that we're all white. So it is definitely a different kind of conversation. The way that I've approached it on a personal level is by advocating for more proactive granting and supporting communities of color, organizations led by communities of color, and supporting work in communities that are most impacted. So with the COVID work, you know, the boroughs that were identified that had the highest level of cases, in large part are communities that have a much higher proportion of BIPOC communities, and you know, this was clear from the very beginning, and unfortunately predictable. And so part of my motivation for trying to pursue that avenue for our work was through the anti-racism lens. That's the sort of underlying framework for me personally in advocating for that, and in working in partnership with the communities. The plans that we funded have been developed by the communities for the communities. And I think that that's also very important. You know, a number of organizations that are participating in this work, you know, maybe some of the organizations that wouldn't necessarily have that first of all already face a lot of structural barriers to their work, and that may not necessarily be the most successful at obtaining grants in like the more traditional way of obtaining grants. And I think that's a structural barrier that exists across the charitable sector. You know, we put out calls for applications, some of us, there are different ways of functioning across the charitable sector, but you need a certain amount of internal capacity, knowledge of the system, in order to navigate it and to even apply for this funding, to report, to provide data. All of these different things require a certain capacity, which is not always found. So it's there are lots of barriers, I think, for those types of organizations to obtain funding. So I think that it also requires us to think a bit differently about how we go about granting as a family foundation, and being comfortable being more proactive. As well as, I think, you know, having more of a link of trust with some of our organizations, and giving them a bit more marge de manœuvre in how they run their operations. Those are some of my own reflections, but I think that there's a lot of work to be done still, certainly a lot. You know, for me, the link, I think the way that you had the question phrased in the type version gives also the link to inequality. And I think that's another piece that I'm also very interested in actively pursuing, and in recognizing the place in the system, the role that I play in the system, and how I've benefited from the system, and the fact that inequality is really at the root of these issues, and trying to address that in different ways, not necessarily through the foundation, but as an individual who's benefited from the system.
Claire mentioned, Marcel, I mean, the barriers, and we know full well that Indigenous and Black voices are largely missing from the decision-making processes of our foundations. What can be done?
Yeah, well, like that, we're a family foundation, so the diversity takes on a different kind of conversation. But to what Conrad is saying, I think lots of blind spots where we are also that we need to start addressing. And the fact of bringing, having the context where we have Black Lives Matter, and we have the COVID coming together. I think Jean-Marc is going to help us think through the whole inequality, inequity issue. And there are some people, looking at how we can better serve and better support Black Canadian communities and racialized communities generally. One thing that hits me is where, and Kevin touched a bit upon it, the TRC report a few years ago, and the Declaration on Reconciliation, the number of private foundations, the community foundations signed on. At first, I think people were wondering what that was going to lead to, but certainly for Lawson and for many others, it actually has been a catalyst for change. I mean, we're very far from where we need to be, no doubt about that, but we really have made some progress, I think, with our Indigenous partners. We're changing the way we think about that. And I'm wondering now if the pandemic is not going to be a bit like that for us in terms of opening up our eyes much more openly to the issue of racism, the issue of supporting racialized communities, etc. I hope anyhow that will be a bit of a silver lining from the pandemic, that foundations like ours will start to be more attuned to that, as we, I think, have been much more attuned to Indigenous communities than we were, let's say, 7 or 8 years ago. So that's a bit of hope on my side, but it's a huge challenge. And like Conrad says, a number of blind spots that we need to address.
We have an Art Pursuit question from a participant on that issue that I think Marcel and Claire, and also perhaps Kevin can answer. Would it be time maybe for Family Foundation to have advisory council with paid members that would be representative of that diversity?
If I can jump in on that, I think that, we're a family foundation. Most of our board, not all, but most of our board are family members. So most are white. We have some diversity, but what we are looking at is the board of directors is one piece of the picture, right? For an organization like ours, advisory councils, individual advisors, granting committees, etc. that we can think of. I think that's where we're going to need to be much more innovative and much more proactive in creating that diversity at the table that we need. I think we do that now as much as we can by listening and by connecting with our grantees and organizations on the ground, but I think we need to also be seen at the governance level, not necessarily just the board, but in terms of our advisors or councils, whatever we want to call them. I think that's the way for us to diversify our viewpoints and allow more openness in those conversations.
Claire, anything to add? Or Kevin too?
Yeah, I mean, I think that's a fantastic idea. And, we've had conversations about having advisory councils for some of our proactive work on the climate change side. And that's something that I have on my mind once we establish something like that would be a very important component. Certainly. At the Family Foundation level, it can be complicated. You're dealing with your family. So there are certainly, I think, efforts that can be made, and I think we can do a lot better. It's not always easy, I guess is what I'll say.
Kevin?
Yeah, so Vancouver Foundation instituted community advisory panels in 1972. And the reason was really because there was too much work for the board to do, so they wanted to get community voices involved. But we've been realizing in the last few years that volunteerism is a privilege that not everybody can afford to take on. And so when we want the voices of those who are most affected by an issue to help shape our granting, we have actually started to pay advisors for their participation in our advisory panels. There are hurdles and restrictions and challenges with doing that, but it's something that we think is actually essential. If we want our grant making to really include the voices of certain populations, you can't expect them to come and work for you for free when that means they're actually stepping away from their paid employment and putting their lives and their families in undue hardship. So we've accepted that's an essential part of reforming how we get the voices of our community.
Thanks. Just a reminder that the topic of next week's webinar Wednesday is going to be the place in philanthropy for Black Canadians. So we'll be going through that issue in greater depth. So let me shift. We have another question from the public. What, if any, changes have you made in how your foundation works? Ways you grant, ways you approach and think about collaboration, ways you use different kinds of data that you will keep once the pandemic is over? Marcel.
A few things. That's a great question. And I just want to say, I totally agree with Kevin that when we bring in volunteers to advise, we have to be able to support them financially to be able to do that. A few things. Convening. We're a big convener. We use convening as a major tool of the foundation. Of course, big shock to us through the pandemic because we can't bring people together as we used to. So we rediscovered how you can convene differently and how you can do it virtually. And it's not only a second best, in some cases, it's a better way to convene. So we're going to continue doing that for sure. There are some issues, particularly when we work with Indigenous communities up north in terms of connectivity. That's a real problem. So we have to address that, but convening in a different way, that's one. Governance. We have, I think, been able over the last 6 months to move a lot more quickly than we've had in the past in terms of decision making. And I think some of that is going to remain in the way we do our work rather than, quarterly board meetings, which we'll still have board meetings, of course, but perhaps the board meetings will be virtual and perhaps will happen more often. So the decision making will happen more often, which is, as you know, as everyone knows, is a frustration very often from organizations who are waiting to hear. We did a lot more on restricted funding, particularly at the beginning. We've always done some of that. I think we'll probably do more because of the need. And the last thing I'll say, we've been doing this for a number of years, and it goes to the data issue that Kevin was raising, Conrad was raising also, the importance of funding infrastructure umbrella organizations. And Jean-Marc, you talked about the survey of the ONN, the Ontario Nonprofit Network, for example. I think of the work that we've seen through COVID of Imagine Canada, Pillar Nonprofit in London, the CCBO in Calgary, and others. The need for foundations to recognize that those organizations are key in these times. And if we're talking about data, they're often the best position to be able to collect that data. So I think that's going to, although we were doing it, I think we're going to continue doing it, perhaps even more forcefully than we've done in the past.
Yes, I have a conflict of interest, but I believe that the ecosystem in Canada for the sector needs to be strengthened. So thanks for that, Marcel. Claire, about practices and behaviors that will stick post-COVID.
Yeah, I mean, certainly, our COVID efforts have been very, very different than our usual way of functioning. So we're involved in the collaboration, like I mentioned earlier, with PFC, but with 3 other private family foundations. So the Lawson Foundation, Jaroslawski, and Saputo, and really working collaboratively together. In some cases, pooling our funding to support these different community-based responses in 6 boroughs in Montreal. At the height of it, we were having weekly meetings, sometimes more. Now it's every 2 weeks. So we are working really as a team, these different foundations who have usually different priorities, different missions, our own independent boards. So it's really a new way of functioning for us as family foundations, working in a collaborative fashion and also doing so with a goal of being proactive rather than reactive. And I think it's been a very positive experience. It's been a learning experience. Certainly, we've gotten to know each other over the last several months. For me, it's been a very rewarding experience, and it's one that I hope we can continue post-pandemic. And I hope that others will want to join us in these types of initiatives, whether it's on COVID or on other problems like climate change. Working collaboratively, I think, is really the way to go. I hope that we can bring that much further into the other work that we do as a foundation as well, and can be a model for the way to go forward.
Thanks. And Kevin, from a community foundation, in terms of new practice and behaviors that...
Yeah, I would say 3 things. We have done a lot more gifts versus grants, where we're trusting the organizations to do what they need to do. And that's been a a welcome shift, long called for by charities. And certainly when I was running a grant seeking charity, that's what I wanted the funders to do, is to trust me and give me a gift as opposed to tie me up in a grant. So we'll keep that. We are trying to lower the barriers to applications, similar to what Claire said. They can be challenging and difficult processes for organizations to get through in a timely fashion. So we're trying to really simplify and streamline our work so that we are more accessible and easier to get money from. And the third one is an increase in delegated decision-making, where we provide a grant to a community foundation, like on the basis that if you're in Revelstoke or Cranbrook or Prince George, you know what your community needs better than we do, so we'll give you a grant and you can distribute it as you wish. And that is also extending into not just geographically based communities, but population-based communities, whether it's the Association of Aboriginal Friendship Centers or other organizations that represent certain populations. We're granting to them, trusting that they will in turn grant that money to their, based on their knowledge.
And Conrad, I mean, the Red Cross is not a foundation, but you work very closely with many community organizations. Any reflection in terms of new behaviors that in practice that you've adopted that may stick post-crisis?
Well, just from an organizational perspective, of course, we've been running this massive emergency response in terms of the Red Cross from very few people working from the office. So I think certainly the practice of office and home is there's aspects of that are going to change. And I think you've talked about this in terms of managing the conferences, maybe flattening our structure more going forward. I think clearly the Red Cross, the Canadian Red Cross, is on a path the last few years of increasing its capacity in emergency, and that has happened in COVID, and we're going to see a growing surge capacity because we need a surge capacity. We saw that in some instances, the only tool in the toolbox was the military, which is not necessarily trained for humanitarian situations. So we're going to see a growing role in that space, COVID. And of course, we want to get out of just the COVID discussion, but how do we learn and better prepare for future events? And finally, I think to your initial point, we've been funding non-profit organizations throughout these different disruptive events and during COVID. So I think you'll see a growing presence in the knowledge and something we could prepare to share as well. We've helped, I think, about 1,500 organizations, that non-qualified donees, technically, all these small organizations, and what we've learned from that in terms of how we support these groups, which are really under the radar. And I think to Claire's point, there's a number of barriers to them getting money, and they're under the radar. They're not registered anywhere, and so that's an area that I think will grow. And we're interested in sharing the knowledge we've collected, and I think that's a gap as well. We don't share enough, and I think there's a strategic role for the sector, but it's not played up enough. I think we need to look at how do we improve the data, improve our sharing across the country, and ultimately improve the work we do.
The next question relates to what you just said, Conrad. Question from one of the participants. There's tension between data collection, listening to the ground, and lightening burdens on grantees, reporting, surveys, etc. How are you thinking about learning from the usage of unrestricted grants during this time? Kevin, can you start?
Yeah, we've had some success in this area working with cohorts. So if we've identified a cluster of funding to a certain set of organizations that are working on a similar issue, we use a collective learning approach, cohort-based. So that, yeah, but it is a challenge because you often with grants and contracts, you'll obligate an organization to report to you. A gift comes with no considerations, but we find that the organizations we fund want to share what they're learning, so they're voluntarily and quite enthusiastically participating in these learning cohorts. So that's one of our key strategies for learning going forward.
Marcel, do you want to add?
Well, yeah, it's interesting because I would answer almost the same thing that Kevin has just answered. We mostly work in a cohort approach where we have grantees working together for 3 or 4 years on various issues. And they do, our grantees really do want to work together, and they realize that by working together, they're going to need to share the data, share information. So that has certainly been it's not perfect, but it's a really important way for people to open up and feel that there's a trusting and safe space to be able to do that. The second thing on the unrestricted, we did a lot more of that during COVID, and we will be going back to our grantees in a very light fashion in the hope that they can tell us a bit how they dealt with that and what the advantages for them was of receiving that unrestricted, that gift that Kevin was talking about, rather than just a grant. So we're going to try to capture that, but we're still learning.
And Conrad, you already mentioned you've been working with many small non-qualified donees where it's difficult to do an unrestricted grant. So how do you approach that?
Well, I think in again, looking at what their situation is, we have not found that organizations were reticent in terms of talking what they do, in terms of providing data. They're actually quite willing. But again, I'm coming back to a larger theme. We don't fund capacity. There's no technological tools. And also, I think the most interesting for the non-qualified donees, most of them don't fill out the forms because they feel that because they're not, it's not for tax purposes, they don't need to fill the documentation. Therefore, there's very little documentation. So there's some basic things we should do collectively as well, maybe working with the federal government in terms of making sure that we gather the information from a general perspective, and then we can dig in a little more.
And Claire, on this issue of capacity and small organization, maybe perhaps you could talk about the approach that the consortium has taken in terms of one borough proposal moving forward, covering many organizations.
Yeah, sure. So I mean, the territorial-based approach that we've used has really been based on boroughs in Montreal. So the city of Montreal is divided into boroughs, and 6 of the most affected boroughs are the ones that we are supporting. And I have to say that also, the work that's being done there, a lot of the groundwork was laid before we even got involved. I know Centraide, which is United Way in Quebec, has done a lot of work that has really laid the groundwork for the successes that we've had. And the community sector is quite well organized in Quebec as well. At the sort of neighborhood level, they have these tables with the community organizations and that local community that sit around the table and exchange. So in order to create these territorial plans, you had these tables and regrouping all of the community organizations coming together with the local borough, municipal leadership, with the local health authorities, with public health, with the Red Cross, working to create these territorial plans, which include having hiring individuals to actually go out and do sort of canvassing on the ground, almost like an electoral strategy, using mapping to go door knocking and see what people's needs are, connect them to food banks if they have food insecurity needs, etc. And there's been sort of a network created of all of these different territories so that they can learn from each other. What are the best practices? What's happening in Côte-des-Neiges that maybe Anse-Cartierville can apply in their practices in sort of a real-time way. So there is a lot of exchange and learning that is happening, which results in, I think, capacity building in the moment. And because of the work that had been done previously, I think that it has allowed us to have this kind of impact, and hopefully these collaborations can continue in the future, even after COVID.
Thanks. The next question that you already started to answer it, Claire, is what is the state of discussion for a common application, which is a bit different from a funding collaborative? So Claire, I don't know if you want to pursue in terms of this idea of people having to fill one common application as opposed to 25 different ones, 25 different donors. And
yeah.
Then the idea of a pool from others.
Yeah, so in these territorial responses, because it groups together many different community organizations, from food banks to organizations that help the elderly, that engage with youth, etc. So that they all have a role to play in this project, and they didn't each have to go and fill out an application and report back the data, they are receiving funds and they are participating in this project. They are helping their populations and using their own expertise, but because they're working in a collaborative way, hopefully it reduces the burden on them to have to go through all of these different hoops. Yeah.
Kevin from a community foundation, that idea of common application.
Yeah, one of the things that we found was, so we launched a pandemic response fund in March, and in the end we raised around $20 million for that fund and dispersed it to some 600 charities. About $10 million came into that fund from other donors who, rather than run their own programs, put the money into our pool. And they did that for a number of reasons. One was to simplify for charities so that they wouldn't have to go to all these other places, because we had money from private foundations, from governments that really wanted to make it simple for charities. And that we also found, though, that many donors, individual donors who contributed to the fund, didn't have the capacity to make the grant decisions themselves. They didn't know which organizations were most affected or which funds they needed. So the pool actually served two important purposes. It allowed donors who did not want to set up a grant program a place to fund, and it allowed charities the ability to go to one place for funding as opposed to multiple. So it proved to be a very beneficial response in this context.
And Conrad, I mean, you supported small community organizations from across the country. How did they approach that? One common application, or it's different for different parts of the country, different sectors?
I think we took the approach that many have talked about here. We've engaged these groups, the representative groups, to make sure we had the dissemination, to question a little bit of the practices, to improve that. And again, we're collecting a lot of data in terms of their situation that we don't find anywhere else. So when we come back to our initial discussion of data, you know, we're finding that this information doesn't exist. Actually, we're creating it because it's not reported anywhere. So again, when we talk about, to Kevin's initial point, if we compare ourselves to agriculture, you know, it's difficult. It's a gap when we look forward in terms of how we share this information. It'd be quite interesting, and I know we're involved in Montreal in some aspects of the Montreal North project, but we are also working in Ottawa, where we visited some 6,000 seniors door to door and are collecting information again, because we're finding from one of the blind spots here are some vulnerable people that are isolated in the community, and you know, what is their situation and how do we prevent them from worsening in this case. So what I'm seeing here is a lot of similar types of responses in this thing, of more proactive. So again, how do we share this information, and how this could feed in terms of other initiatives, so we don't constantly reinvent a new project and build another plane on the tarmac in future crisis. So I think again, this is the positive side, I think, of the pandemic. We realize we can come together as we're doing today without having to organize a complicated conference and, you know, everybody have to fly into somewhere. You have to do those a few times, but you can exchange in a much easier way also on an ongoing basis as we're doing today.
Thanks. Marcel, any thoughts about common application and versus pool funding approach by funders?
Yeah, well, I'm a big believer in pooled funding. We don't do a lot of it in Canada, but it is starting. There's a collaborative up northern Manitoba around food security. There's certainly, of course, the work that the Indigenous Resiliency Fund is doing. We've quite often informally agreed on a common application with some of our partners, like the McCain Foundation, Howman Foundation, on a one-on-one. But I have to say, during the COVID, we've actually moved away from application during the COVID period. There were no applications, there were indications of interest, and then it was really community driven. So rather than asking for the applications, we got people to tell us through trusted marketers what they wanted to do when we went that way. One, to accelerate things and to take off the application burden off the shoulders of organizations. So now that we're going to move away from applications entirely, for sure, but I think it will influence the way we look at it and the way we can hopefully simplify things, particularly with organizations that we know well, that have a very strong track record with us. I think we can deal with them a bit differently than totally new partners where there's no relationship.
the issue of trust-based philanthropy. Time is running out. It's a very rich conversation, but we have one big question to close our hour. What do you think the future of Canadian philanthropy will look like in light of the many challenges being discussed at this webinar? So just at the same time, your concluding comments for this webinar. So let's go around the table. Perhaps start with Kevin.
Thanks. So I think one of the things is we have to recognize that social cohesion is going to be key to our capacity to get out of this pandemic. Fragmented individualistic societies will not perform as well as those that collaborate. So I think Canadian philanthropy needs to push for the things that will help us work better collectively. But the three things I would say about philanthropy in the future, I think the pandemic is going to unfortunately reinforce two existing trends. One is that Canadian philanthropy is seeing more money from fewer people. You know, with the K-shaped recovery, that's going to continue. So this is an unfortunate trend in philanthropy, but it's one that will continue. The second is that charities have been struggling to diversify their income over many years. This pandemic has revealed some of the limitations of that, but we will see more and more organizations seeking social enterprise and diverse sources of income. And then the one where I'm a little optimistic is I think the pandemic will start to create a break perhaps from philanthropy that tends to serve the needs of the donor, like the donor, perpetuate the interests of the donor, to more philanthropy that serves the interests of the affected communities. And that's the hopeful piece, that the philanthropy will become ever more related to the needs of the communities we serve, as opposed to the interests of those who donate the money.
Conrad.
Not that it's always a binary; they're often overlapping, but you know, in terms of the
Well, I definitely agree with everything Kevin said. I think more joined up, less fragmented funding, more collaboration, I think, is the key going forward. I think we are, and I want to be optimistic here. It's always terrible when you invite the Red Cross about talking about being optimistic about things, but we're going to go, the agility is going to, and the communication and the collaboration is going to be required, because we're going to go in through other challenges that we're not out. The post-pandemic is going to also, we're going to go into another challenge of public spending, potentially, a diminishing of public spending, you know, of mental health challenges, and so on and so forth. So I think these are the positives of what we're working on now and how we're collaborating. Now we're opening up the channels and looking at things that need to be pursued, and the agility that needs to be remained to be able to adapt to the issues ahead of us. And again, the learning of where the gaps are right now, and looking ahead as well in terms of better preparing ourselves in terms of resiliency and of the organizations that we support.
Marcel?
I'm in a hopeful mood, I think, like Conrad and Kevin, firstly. One, I think we're going to be more open. I hope we're going to be more open as a movement. I hope we're going to see much more pooling of funds and people coming together. I hope we're going to be better equipped on the data issue that Kevin and Conrad raised. I think we need the data to be equipped. And I hope we're going to be a much more of a partner, not only for the nonprofit sector, but for government, and even in some cases for corporations. But for that to happen, we're going to need a much stronger narrative about who we are and what we do. I was part of a conversation earlier this week at Foundation House among foundations, but we had a few nonprofits at the table with us also, and we were talking about some of these issues. And we were told very clearly, we have no idea that these conversations are happening within the foundation world. We have no idea of your thinking about these things. And that really hit the mark, because people don't have an idea. We don't talk about it. We have no narrative about what we're thinking about, what we can actually bring, and what our attributes are. So in a hopeful mood, that will all be changed by the end of this pandemic.
Claire, are you also as hopeful as the other co-panelists?
I guess I will be hopeful the right remarks. Yeah, I mean, I think hopefully collaboration will only intensify as things move forward. Hopefully, those of us who are engaged in collaboration have benefited from that experience. I think that we have, and hopefully that will encourage others to join in collaborative efforts. I really believe that is the path forward. And And I'll leave it at that.
Merci Claire. Je veux remercier tous les panélistes pour une conversation extrêmement riche aujourd'hui, mais également pleine d'espoir. On est pragmatique, on est réaliste vis-à-vis les défis qui nous font face. But some very clear ways to increase the impact, the collective impact that we can bring in the midst of this historic moment that's going to last over the next year and beyond, most likely. So on that note, I'd like to remind everyone that we have this Mind the Gap, the State of Philanthropy in the Black Community next week at the same time for webinar Wednesday. And I'd like to thank all 4 panelists for your time today. And we'll have to do that again as we hopefully emerge from the other side in the next few months, but let's keep our fingers crossed. So, merci encore.
See.
Bye-bye.
Bye, everyone. Thank you.
Bye-bye.